Dispatched to a private residence for a patient with an abdominal injury. Upon arrival, you are met by a frantic wife who leads you to the backyard. Lying next to a tree and a fallen ladder is a middle-aged man with a tree branch sticking out his right side. His wife tells you that he was trimming the trees when she heard a crash and ran outside to find her husband lying on the ground.
So, scene is safe, BSI. So I'm seeing one patient lying supine. Patient seems to be a middle-aged patient. The mechanism of injury, I'm seeing a tree. It appears that the patient fell out of the tree and there is an impaled object in the patient's abdomen. I'm going to consider C-spine stabilization and additional EMS resources. Sir, if you can hear me, I'm an EMT. I'm asking you not to move your head. At this time, I would ask my assistant to manually stabilize the patient by using both hands to hold the patient's head from that position. Now that my assistant has stabilized C-spine, sir, my name is Kevin Richards and I'm an EMT and I'm here to help you. What happened to you today?
I was trimming the tree and I don't know, I misstepped and I fell on the tree and yeah.
Okay, do you know what day today is?
The alarm not gonna beat.
Which-
Friday.
Oh, so today is Friday.
Yes.
So my patient is alert and oriented to time, place, and event. So my patient's airway is patent. What's my airway?
Open and patent.
Open and patent. At this time, I would assess breathing. So this patient has 20 breaths per minute.
Correct.
It is regular on both sides and deep.
Correct.
Okay. At this time, I will move into my circulation. I will do a rapid scan of the patient to see if there is any other bleeding apart from the impaled object. Am I seeing any other bleeding?
No.
Okay, so at this time I will get a donut dressing and I will apply it to the patient. I'll use tape to secure it to the patient and then I will move into assessing his pulse. So this patient has 60 beats per minute. I'm checking to see if I can, what it is bilaterally. So it's equal, it's bilateral, it's strong, and regular. What's my pulse?
His radial pulse is rapid and threading.
It's rapid and thready. Okay, I'll check my patient's temperature. What's the temperature and skin color of my patient?
He's cool, pale, and diaphoretic.
So it's cool, pale, and diaphoretic. At this time, my patient appears to be going into shock. I will administer oxygen to this patient, 15 liters per minute, via a non-rebreather mask. I'll administer that, and that is on my patient. My patient is a high priority patient for transport. However, my patient is a trauma patient, so I will move into my sample history. Sir, are you allergic to any medications?
No, I'm not.
You're not aware of any. Okay. Are you on any medications at this time?
I am quite a leprosol and aspirin.
Okay, first aspirin. Have you taken any of these medications since?
I have
Okay. When was the last time you had something to eat?
this morning breakfast.
What you had?
Tea and toast.
Tea and toast. And what you say you were doing when this happened?
Trimming the tree branches.
You were trimming the tree branches and what happened? You were in the tree?
I was in the tree, I misstepped. Oh no, I ended up on the road.
Okay. So the chief complaint is the impaled object in the right upper quadrant of the patient. I'm going to move my patient into the ambulance, but for me to do that, I need to carry out my secondary assessment, which is a full body scan of this patient. So I'm going to start from the patient's head. Now I'm checking for any open wounds or anything, any leaking from the ears. I'm going to check for pearl. Is my patient's pupil equal and round and reacting to light? I'm checking to see if the trachea has deviated from midline. I'm checking the jugular veins for distension. At this time, because my patient is suspected for C-spine, I will now administer my C-collar. To administer my C-collar, I will measure my patient's neck. My patient has a short neck. I will look on my collar and make the necessary adjustments. For short, on this one it says necklace. With the assistance of my partner, I will put this C-collar onto my patient. Leave the necklace spread up. Okay, I will now move into checking the rest of his body, the clavicles and the shoulder for decap BTLS. I will palpate the areas outside of the area of the injury. I'm checking the sternum to ensure that it is midline. Are there any injuries?
No. Abrasion to the right abdomen.
Okay, so there are abrasions to the right abdomen. Okay, I will move to the, just relax your hand, sir, to the pelvic area. I'll push down on the pelvic, push in on the pelvic. I'll check the genital areas. Are there any injuries?
None.
There are none. I will now check the lower extremities. For decap BTLS, I'll check for pulse. Motor function, sir, could you push down on my hands? Okay, could you pull up? Okay, sir, can you feel that? Can you feel that? Yeah. Okay, I'll now move to my upper extremities for decap BTLS. Check for pulse. Strong. Good, sir, could you squeeze my hand? Okay, sir, can you feel that? Okay. Decap BTLS. Check for pulse, motor function, and sensation. Can you feel that, sir? Yeah. Okay. At this time, I would ask for an assistant to put my patient onto the spine board. So I will need to log roll the patient. To log roll this patient, I will, sir, just relax. I'm going to move this arm above his head. I'm going to hold the torso area of the patient. My assistant will maintain manual stabilization of the head, and somebody else will assist, if possible, with the lower extremities. Now, I will log roll the patient to me on the count of my assistant who is manually stabilizing C-spine. So on your count, we will log roll the patient, which is on 2. He counts 1, 2. I log roll the patient to me. At this time, the spine board will be brought in behind the patient in position, so that as soon as I'm finished checking the posterior areas of this patient for decap BTLS, so we're checking the posterior, decap BTLS, checking the back, buttocks, the back of the lower extremities. Are there any injuries?
No injuries noted.
So at this time, we will log roll the patient onto the spine board, upon the count of my assistant. On your count, you roll the patient onto the board. If the patient is not properly on the board, we will slide the patient down and across, up and across until the patient is on the board properly. Then we will secure the strap for the torso, the chest, and the lower extremities. We will now move our patient into the ambulance. When we get into the ambulance, we will now carry out or vital signs. Sir, just relax. I'm carrying out some more tests just before we move up, okay? So this patient gave me 120/90. What is my
100/56.
100/56?
Yes.
Okay, I'll check for respirations. This patient gave me 20 breaths per minute. What's my respiration?
20 breaths per minute.
20 breaths per minute. Pulse. I'm checking for pulse. This patient gave me 64 beats per minute for pulse. What's my pulse?
130 beats per minute.
130 beats per minute. I'm going to check for pearl. Is pupil equal and round and reactive to light?
Correct.
Okay. And I will reassess my interventions to ensure they are okay. We are in transport. Because this patient is a high priority patient, we will reassess this patient for interventions, primary assessment, which is airway, breathing, and circulation, and vital signs every 5 minutes. So I'm now going to hand over this patient. So, got a call from patient with a impaled object in the abdomen on arrival. Patient was seen with the impaled object in the upper right quadrant. Patient was alert and oriented to time, date, and event. Patient was administered 15 liters of oxygen via a non-rebreather. Patient exhibited signs of shock and was treated. Patient, upon reassessment, had a blood pressure of 100/56, a respiration rate of 20, and pulse of 130 beats per minute. His pupils were equal and round and reactive to light. Patient was not administered any medication, and we're handing over the patient.